What is cerebral palsy? This is brought to you by Burke and Eisner, nationwide medical malpractice attorneys handling cerebral palsy cases. Cerebral palsy is a disease, but that's a slightly misleading way of describing it. It's really a collection of disorders, often movement disorders, that once collected together are categorized as cerebral palsy. I'll get into what those disorders are in a minute. Approximately only 1 to 2 babies out of 1,000 are diagnosed with some level of cerebral palsy. Cerebral palsy really is an indication that there has been some sort of damage to the brain, and that damage occurred in an area that has caused movement disorder of some sort. So people have difficulty controlling limbs, or they're excessively stiff. And this leads to the 3 major types of cerebral palsy, which are spastic cerebral palsy, athetoid, and ataxic. These are basically all cerebral palsy, but just different types, where one might be characterized by an excess stiffening of limbs, and another might be more characterized by a lack of coordination or balance. Some of the symptoms that you might see with cerebral palsy are tremors, shaking. You might see excessively stiff arms and limbs, or just the opposite of that. You might have very loose and floppy muscles, difficulty walking with some leg dragging or foot dropping, some difficulty speaking or drooling or swallowing. All of these, as you might notice, are related to the ability to control muscles and the ability to have those muscles do particular tasks. That's really what cerebral palsy is about. Some of the risk factors and causes of cerebral palsy, we do have a more in-depth video on this, but briefly, it can deal with oxygen deprivation during labor, where blood flow to the baby through the mother's umbilical cord might be interrupted for a time period. It could have been caused by an infection or some sort of a trauma during birth process. It could be due to just preterm birth, a baby being born too early, so the brain hasn't had enough time to develop. Diagnosis of cerebral palsy is not as simple as one blood test and you're done. It's more of an observation and a collection of all of these symptoms that we've just been talking about, and you present those symptoms, your doctor sees those symptoms, and you decide, yes, this is what it is. It appears that something happened that has caused some injury to the brain where it has resulted in these movement limitations. Typically, treatment is limited to being able to treat the symptoms of the movement disorder. You're able to try to provide therapy, speech therapy, physical therapy, therapy to help strengthen muscles. There's also some cases where you can use surgery and medications to improve the ability to walk and or use particular arms. Another piece that's important with treatment is the development of assistive technology. Advancements in wheelchairs and computers and hearing and voice aids have really drastically helped people with disabilities, and it's well worth looking into. This has been a really brief presentation on what cerebral palsy is. It's brought to you by Burke and Eisner. We're national medical malpractice attorneys. We handle cerebral palsy cases all over the country. If you'd like to have some questions answered, or you have a case that you'd like to speak with us about, please feel free to give us a call. We'll be happy to discuss it with you.